Good afternoon, members of the media. Good afternoon to viewers and listeners in Trinidad and Tobago. I'm dropping in on a press conference which really would be carried by the Ministers of Health and the Minister of National Security and the staff, senior staff from the Ministry of Health. I'm on my way to a funeral in my constituency, so please excuse me. After I've spoken to you, I'll just leave immediately. But I thought I would join this team because the issue that we are focusing on today is the whole question of our preparedness and concern for the fast-moving developments surrounding the virus, the coronavirus that we have been dealing with for the last few weeks. I simply want to say that the national community should be satisfied that we as a country have expressed the level of concern, because this matter is one that has significant interest for us as a nation. First, let me say that we have a Ministry of Health that is staffed by some of the best professionals in the region. There's a Minister of Health whose responsibility is to ensure that the Ministry of Health discharges its responsibility to the nation. We are also in Trinidad and Tobago the home of the Caribbean CAFA, which is the regional health authority there, and we are also members of other institutions like WHO and PAHO, where we get guidance and information to allow us to make the kinds of decisions that we need to make within our borders. Secondly, Trinidad and Tobago is a very highly connected nation. Virtually every country in the world can present to you some members of the national community of Trinidad and Tobago. Our diaspora is very wide, so we have nationals all over the world, and that will have its consequences in matters of this nature and in these times. And thirdly, we are a nation that has a very significant reliance on the external markets and the external economy. We are a trading nation, and we have significant business outside of Trinidad and Tobago, and personnel and equipment and goods come into our country. So in short, this virus that has been identified as originating in the Wuhan area of China, and for which the Chinese are making superhuman efforts in trying to isolate it in that location, we have to be concerned about the progress in China and outside of China, because a virus being the kind of pathogen that can easily be demonstrated to pose a threat to every person who is exposed to a person who is already infected by the virus. So it means that once people are moving around, we all have the same issue to deal with. It is not as a result of any nationality, any religion, any race. It is a human condition, because the virus is posing a threat to everybody in every country. I am not sure yet why PAHO has not deemed it to be a pandemic, but that is something that the technicians at PAHO and the various agencies will deal with. But we, looking at the news coming to us from around the world, every day you're seeing more and more countries having to report that they have nationals or persons within their border who are infected. And Trinidad and Tobago is no different. We would expect that, or I should say, we hope that at the end of the day, by the time the virus will have run its course, like other viruses, that it may not have come to our borders. But given the kinds of connections that we have and the businesses that we do around the world, it is quite likely that somewhere along the way we could be exposed to persons who are infected being in our border or coming to us as nationals who have every right to return to Trinidad and Tobago. We cannot deny access to nationals of Trinidad and Tobago who choose to return to Trinidad and Tobago. And we have certain protocols in place, which the Minister and his staff will go into some details on later on. But certainly, we have put at the very beginning, understanding what this virus meant. And if we find ourselves with persons coming to us with the virus, what it would do to us, we very early put certain arrangements in place where nationals who come home would be subject to a quarantine, which we are anticipating on the information that we have would be covering the gestation and representation period of the virus. And also, if persons have come from areas, initially it was China, we had said, but today Cabinet has taken a decision, which the Minister will go into in a little more detail, identifying other areas outside of China, which have been now deemed to be areas where the virus is present on a scale that warrants those areas to be viewed in a certain way. And we have taken decisions so that we would minimize the kind of exposure that we have to persons who may be traveling and may have been already infected and carrying this virus either in an asymptomatic way or with the symptoms of the virus that the doctors will talk about later on. But there are some bigger issues here for us, because as we look at the effect that this threat of the virus is having on the international trading community, we in Trinidad and Tobago have some serious exposure. For example, you would have seen the record collapse at the stock exchange. Don't think that we are not involved in that. The performance of our Heritage Fund is directly impacted by the performance of the stock exchange, because that is where that investment largely lies. So if the exchange is doing well, then our earnings is doing well. If the exchange is doing badly for whatever reason, then we have concerns there. And this time more than ever, to have our Heritage Fund underperform or threatened by a collapsing market is something that every citizen should be knowledgeable about and hope for the best at the market. We also are trading in products for which the demand is of interest to us, because if the demand is not there, then the prices of those products that we trade in would fall. Yesterday I was looking at the performance in the gas and oil sector, and there are some serious developments there, largely driven by concerns that the Chinese economy may not be as robust as it was predicted to be. In fact, before this virus came on the scene, there were predictions that the Chinese growth was being reduced, and it was having some knock-on effects on the projections were that there may be some decline, and the markets were very soft. We had a fairly warm winter where the demand for natural gas was not as high as it would normally have been in a cold winter, and there's an oversupply of natural gas in the market, so this has kept the price quite depressed. You would have known that we budgeted natural gas, I think it was $3.25. Natural gas is now $1.92, and there's all kinds of forecasts which are not very optimistic. The whole question of the demand for energy could fall if the economy of China and the knock-on economies, because the way things are done nowadays, very many countries' economy, especially those that are involved in manufacturing, they get a lot of their inputs from factories in China, and some of those factories are now not operating, and if there's no movement of people and goods in and out of these factories, it will automatically have a certain kind of effect. And those effects are directly of interest to the people of Trinidad and Tobago because we are in the marketplace for gas prices and oil price and for methanol price and also for the whole question of preservation of our population here in Trinidad and Tobago and those who may be in areas that are affected and may choose to want to return to Trinidad and Tobago as a result of what is happening where they are now. Many of those persons are not known to us now, but if this situation worsens, it is quite likely that there will be citizens who are somewhere who would think that the best place to go is to Trinidad and Tobago. And we have to be careful with that. So I just raised this so that the national population can be alerted to the fact that there are far more concerns and consequences for us than the individual health. That is primary, that's number one. But there are other concerns where, with this virus, if it does not run its course in the shortest order. The experts are telling us that it may be a while before we see, any reduction in the threat that it poses. But in the meantime, I would say the whole world is now concerned that the presence of this virus and its effects on populations in all the activities. You would have seen, I think, the Japanese, the Olympics in Tokyo is now up in the air because the information I'm getting is that the authorities are saying that they wouldn't even consider a postponement. Any action to be taken would be a cancellation of the Olympics. And others, you've seen other big events have been cancelled. Only today we had a conference in the gas conference in Qatar, is it? Yeah, which is next to Iran, being so close to Iran. They've cancelled that international conference. We were due to be present there. It has been cancelled because the movement of people is what is, creating the environment for the pathogen to be taken from one place to another. We have taken decisions today to identify the 3 or 4 areas where outside of China, where it is now seen that there's a population of affected people who we would want to treat in a particular way and restrict our exposure. At the moment, that's what we're aiming to do. Restrict our exposure to eliminate the good chance of persons carrying the virus from wherever they may have picked it up to Trinidad and Tobago. And this is a matter for the Ministry of Health, supported by the Ministry of National Security, because the first people who are required to deal with anybody coming into our country is first is Port Health, and then it's the Immigration Department, and after that there are other things. And in the event that we are unfortunate to have persons coming to us who belong to us, who we can't turn away, or those who accidentally come to us, and once we have the virus in the country, the next step is how do we deal with it? What preparations we have made? How prepared we are? What are we anticipating? Now, all these questions, the 4 gentlemen here, 2 technical people and 2 members of the cabinet, will answer all those questions for you. So I just want to leave you with that we've made preparations, we are following protocols. The protocols, in some instances, we are ahead of what the WHO is saying to us, but we have always anticipated that this is something very serious, and it is now posing not just a threat to life and limb, but it's also a serious threat to our economic well-being. If you have a question or 2, I'll take it now, but I'll ask for your excuse, and I'll leave you in the hands of these 4 able gentlemen. If there's 1 or 2 questions that you want to put to me, I'd take it now. No questions? So that
Ryan Hamilton Davis, Trinidad Newsday. Exactly how is Trinidad and Tobago handling the relationship between between our country and China where this virus is originated? Because we have a lot of connections, yes, as you said, but there are also a lot of projects taking place. Has it been affected?
We have, in terms of the projects that are taking place, what has happened is that the response to the virus and the threat and our attempt to keep it out is forcing us to reduce and stop the movement of persons coming from any area where the virus is prevalent and poses a threat of infecting us. The virus is identified in one part of China, and we, in keeping with the common sense arrangement, very early in the game, we had restricted the entry, direct entry from China to Trinidad and Tobago within the 14-day period, which is what the scientists were saying to us is when the virus could be transmitted. So if you had been to China under 14 days before you got here, we had made that not an acceptable state of affairs. And if you do come in, as our nationals would have to come in, then we had quarantine arrangements and protocols in place for that. That has not changed. What has changed is that the virus is no longer only in China. It has been propagated into other parts of the world where we do have contact. And now there's some serious concerns in Italy, in Korea, and elsewhere. And we have taken steps today, which the Minister will tell you about, to ensure that we minimize that exposure. So we started out with a concern about contact with China. Now it is, as the virus moves across the world, there are other areas of concern where the presence is at a level that causes us to want to restrict interaction with those areas. And the same protocols. One of the things that you would see if you follow the news is that even the experts in the developed countries are saying that there's a lot that we still do not know about this item, this pathogen. So it's a learning process in many instances. So we just are being as cautious and as careful and in the common sense arrangements that we have put in place.
Carnival, we just came out of Carnival. How has this virus affected?
Well, much of our Carnival went off very well. We've had no, as I speak to you now, we have no instance of any confirmation of any virus in this country. A lot of our visitors came from North America, where there are few instances of reports, but even so, there's an increase in the number. And therefore, we keep our eyes on it. But we, notwithstanding some person felt we should have cancelled the Carnival, we didn't think that was necessary. Because the one thing we want to do is to keep a level head in responding to this threat. We don't want panic. We don't want exaggerations. And certainly the worst place to be is in a place driven by fear. Right? So we want to be very level-headed and be informed and making good informed decisions without panic and without generating unnecessary fear. And keeping our Carnival was in line of what I just said.
We'd like to talk about the issue of disinformation, because we've had over the Carnival period, the ministry, I think, had to put out a press release denying that somebody had contracted the virus and so on.
No, well, there are some very irresponsible people around, right? And what social media allows is for irresponsible people and other people with agendas to try to create this fear and panic that is not to be encouraged. And virtually every day we have people putting misinformation out there to create for their own entertainment and other kinds of agendas to create panic. They started up, talking about Chinese shippers in Point Lisas with dead people being brought off, and they saw Simpson taking off body. Some people are just horribly irresponsible. We've had one instance of a person coming into Tobago, and the protocols worked very well. Everybody was alert, and they all did their jobs, because we have to be ready in the event that such a situation develops, where persons come to us, either having been exposed or are in fact presenting with the virus. We have to be ready for that, and that's what you'll hear from our experts here this evening. Thank you very much. I'll leave you to the hands of these gentlemen, and they will answer all your other questions. Thank you very much.
Right. Good afternoon, ladies and gentlemen of the media. Um, before I start, let me just introduce the two gentlemen to my right. To my immediate right is Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, Trinidad and Tobago. To my far right is Dr. Malachi Ojoro, Medical Chief of Staff at Eric Williams Medical Sciences Complex, under the North Central RHA. And very soon you will understand why he is here when I make my announcements. So the Prime Minister gave you a very good and excellent global perspective. The Ministry of Health has been looking at this issue on an hourly basis for the past 3 weeks, since the 30th, I believe, of January, when we first came to the media to talk about travel restrictions out of China. From then to now, the situation has changed rapidly. What is a major change now that is driving further action from the Ministry of Health? Whilst the number of new cases in China seems to be going down, and that is a good sign, the flip side of that is the number of cases outside of China is going up. You have had outbreaks in 4 or 5 countries, significant outbreaks. Those countries are South Korea, Italy, Iran, Japan, and Singapore. The Cabinet has authorized the Minister of Health, working in conjunction with the Minister of National Security, to impose as soon as possible the 14-day travel restriction that was implemented for China. So we are adding South Korea, Italy, Iran, Japan, and Singapore. What the Cabinet also authorized is that the Minister of Health, without having to come back to Cabinet, has authorized the Minister of Health, in conjunction with first informing the Minister of National Security and the Prime Minister, as the other further countries that will be added to this list. So I will not have to come back to Cabinet every week or every 2 days. As the situation evolves, the Minister of Health, relying on expert advice, will first inform the Minister of National Security and the Prime Minister to add other countries as we see fit. So that's the first major decision taken. The second major decision taken is that preparedness now. How are we prepared to deal with an outbreak in large numbers if that should happen? We are working with 5 concentric rings, if you may, or tiers of preparedness. Tier 1, Cora. We already have a 4-bedded quarantine area. 2 weeks ago, I would have given the North Central Regional Health Authority the directive to open a new 20-bed facility. So we are adding 20 beds to Cora, which will be ready in about 2 weeks. So we are significantly increasing our capacity to deal with coronavirus outbreak in Trinidad and Tobago if it should come. Out of Cora, we now expand. We just opened a 67-bed facility in St. James that could be pressed into service if required. In another 2 to 3 weeks, we'll be opening a new facility in Port of Spain General Hospital, the old Costad building, which has isolation capacity. That is Tier 3. Tier 4, in the event that there is a serious outbreak, we must have a major medical facility, which could be quarantined, locked down by security, and that is where the Minister of National Security will come in. That facility, as advised by the Cabinet, by the Ministry of Health, and approved today, will be the Couva Hospital. That will be designated as a level sort of 3 facility, because there now you have ICU capacity if needed, you have operating theaters if needed. That facility is currently being operationalized to do just that and has been for the past week or so. Out of that, now we have to look at Tobago. We will be working with the Tobago Regional Health Authority through the Chief Medical Officer to ramp up their isolation capabilities. So that's the second major decision taken. We want to reassure people that we are looking forward into the future, and in the unlikely event there is an outbreak, we have the capacity to deal with it in terms of bed space. And the advantage of using CUVA is that you can localize your expert treatment. You can train your staff very diligently, your frontline staff, make sure that they are safe, because you also have to make sure your staff is safe. The other major decision that the Cabinet took this morning, you may recall when I first came, when we had our press conference on January 30th, I did indicate that WHO is saying now that the new normal as far as global health is concerned is that all countries have to get accustomed to these new novel diseases that are going to crop up from time to time, whether it's Ebola, whether it's chikungunya, whether it's Zika, whether it's anything else. What the Ministry of Health recommended today and Cabinet has accepted is the setting up of a sort of standing committee to deal with public health concerns and emerging infectious diseases. That committee will be chaired by the Chief Medical Officer, and they will be reporting jointly to the Minister of Health and the Minister of National Security, because these new emerging infectious diseases have a serious national security component. I will run through the list of people and bodies who will sit on that committee. So the Chief Medical Officer, the Chief of Defense Staff, the Chief Immigration Officer or a representative so designated, a representative of the Commissioner of Police, representatives from the Office of the Prime Minister, the Ministry of Finance, because in case you need emergency funding to respond to any major infectious disease in the future or coronavirus now, there are financial implications. Ministry of Works and Transport, especially the Maritime Division, because the same focus we are putting on airports as a port of entry, we also have to put on seaports as a port of entry. The Ministry of Education, how do we deal with children going to school? Ministry of Rural Development and Local Government. That ministry is a first responder ministry in any natural disaster. Ministry of Tourism, because this will affect our tourism product, our tourism thrust. Similarly, Ministry of Trade and Industry. You would have heard the Prime Minister speak about the trade implications. Of course, the Ministry of Foreign Affairs and Ministry of Foreign and CARICOM Affairs. These measures will have diplomatic implications. Ministry of National Security, as I said, to get at our communications plan, the Ministry of Communications. There may be a social development issue where vulnerable families have to be supported in these times. So the Ministry of Social Development and Family Services, the Airports Authority, Civil Aviation Authority, the Port Authority of Trinidad and Tobago, Office of Disaster Preparedness and Management, as I said earlier, Commissioner of Police, and of course the Tobago House of Assembly and TEMA, the Tobago Emergency Management Authority. So it's a very exhaustive list of first responders, policymakers, reporting jointly to the co-chairs, which will be the Minister of Health and the Minister of National Security. What will they be responsible for? 1, translating WHO strategic objectives into the national context and developing operational plans. They will be involved in leading and developing those implementation plans and providing oversight and evaluation of the activities. And of course, reporting and advising the Minister of Health and Minister of National Security as co-chairs. So just to recap, the Cabinet took the following proactive steps to reassure the country that we are ready to deal with COVID-19. But before it gets to our shores, we want to take all reasonable measures, and I want to stress that, all reasonable measures to prevent the entrance of the virus into Trinidad and Tobago. However, if it should enter, we are in a state of readiness, and what I want to reiterate to the media and through you to the general public, there is no place for panic in any of this. We will conduct ourselves responsibly. We will come to you, the media, and the population with information, as I have been. As you know, I speak to many of you on a daily basis. We will come to you with information and be as transparent as possible. I want to urge the national community to pay no attention to social media. You have those people who are irresponsible and do not have the country's best interests at heart. So before I open up and before I let the Minister of National Security speak, the government is in control of the situation, and I want to reassure Trinidad and Tobago, we are ready. Thank you.
Thank you very much, Minister Deyalsingh. As the Minister of National Security, from the time this virus, previously known as the coronavirus, surfaced internationally, I've been in contact with the Minister of Health on a daily basis, having necessary conversations. We have taken certain steps before getting to this situation. What I want to assure the public about is that the government, through its various agencies, with the primary agency being the Ministry of Health, has been acting completely in line with international health protocols. And in fact, as the Prime Minister mentioned a short while ago, we have actually been amongst the first nations, if not the first nation, to take some of the steps that we've taken to assure the public that we have at all times been working with respect to this issue. So any noise that you may hear outside is really noise to be ignored, because at no time have we not been on top of this via the Ministry of Health with support from the Ministry of National Security. Yesterday, there was a significant meeting where I attended as the Minister of National Security, along with the head of ODPM, who will be the first responding agency to assist in any need that we may have. And there present were the PAHO and WHO representatives, as well as CAFA and the Ministry of Health representatives. Some significant discussions took place and decisions took place there. We have been in contact, for example, with the private ambulance. I was in communication with one of the owners of private ambulance services to tell them that we need their first responders with the right PPE kit and to be trained. Yesterday, I also asked for specific training and also refresher training for members of the Trinidad and Tobago Defence Force and Trinidad and Tobago Police Services, who will obviously play a part as and when this develops. We just want to be in a state of preparedness. We had discussions with respect to cargo ships, with respect to cruise ships, certain decisions as to how we would deal with those persons on board the ships before they disembark. As the Prime Minister pointed out, immigration has a role to play here. So the assurance is that national security is very much a part of it. We are prepared to play all supporting roles deemed necessary to support the Ministry of Health, and also to assure the population of Trinidad and Tobago protocols are already in place. What we're doing is we're increasing our capability and our capacity. I would like to thank all of the persons who've been working on this, not only the Ministry of Health officials and personnel who have been doing a tremendous job and a great job in terms of preparing themselves, but also arms of national security. I was very heartened to hear yesterday, for example, our Air Guard has been playing a critical role throughout the CARICOM region in helping CAFA with the testing from other CARICOM jurisdictions. Our Air Guard has been using our aircraft to assist in that testing. We have sufficient test kits here, more on the way. We've been looking at and doing an audit of the PPE equipment. Again, we have sufficient equipment here, and we're also looking to increase that. I gave instructions yesterday as well to the ODPM for us to increase our capability of screening, to assist the Ministry of Health personnel through our emergency procedures, and to get more screening devices and bigger screening devices to assist, for example, with the cruise ships coming to Trinidad and Tobago. So the population should be assured that the government at no point in time has not been focused on this issue. We went through a carnival, a very successful carnival period, where again we were working in the background, and the Ministry of Health has done yeoman service and a great job so far. So it's just to give the assurance that national security is very much involved. As you heard the Minister say, Cabinet has decided that we will co-chair. I am here to support the Minister of Health. The Ministry of National Security is here to support the Ministry of Health in whatever way that will be necessary and be needed. I think at this stage we'll open up for questions and the appropriate person can answer.
So you mentioned these 5 countries, Iran, Japan, and whatnot, which will be added to the travel restrictions, right? Could you see when these would be added to the list officially?
That becomes an immigration issue. So the answer is exactly as the Minister said, as soon as possible. The instructions will go out to immigration immediately. Now, we also recognize that persons may be dishonest, because we faced a bit of that with other authorities, may be dishonest in the information they're providing. Hence the reason that we're having screening taking place. And I was happy to be informed that it is a 2-level screening taking place at our international airports as well. So immediately these instructions will go to immigration. Immigration and civil aviation will give the necessary directives to all of the international agencies, civil aviation to the airlines across the world that Trinidad have now imposed these restrictions with respect to these 5 countries.
Okay, and I remember I contacted you a while back where there was an incident where after the original restriction was implemented, it took some time for that directive to reach down on the ground at the immigration level. Has this communication delay been addressed so that we could get more immediate
just answer that. I mean, you have to understand when these things are implemented, there will always be some teething issues, but it has already been implemented. So this is now an addition. So there should not be any reoccurrence of that small little time frame that it took to take place, which I believe was maximum of 48 hours. So it is in place. This has been going on. Immigration have been in contact with the Ministry of Health. In fact, yesterday in our meeting, there was communication going on between the Ministry of Health and Immigration. So it is very, very proactive, and it is now just the implementation of additional designated areas. And you all would have heard Cabinet took the decision, a sensible decision today, to give the Minister of Health the authority to go ahead and add to this designated list after consultation with the Prime Minister and the Minister of National Security, because we expect it to grow. When we were in the meeting yesterday, the international experts at 1:30 yesterday afternoon were telling us there were 14 cases in the United States. By the time I came out of the meeting an hour and a half later, international news were reporting over 50 cases in the United States. So we are very forward-thinking. This committee that has been set up, that will be chaired by the CMO with the right population, will continue to advise us on an hourly basis, on an as-needs basis. We are in a state of preparedness.
And for Trinidad and Tobago nationals coming from these countries, the protocol will be self-isolate for the 14
Correct,
period.
because our law is, the immigration law is that we cannot deny citizens a right of re-entry. So we have put those protocols in place for either quarantine or isolation, as the case may be. And I'm going to put it on the table now. National security outside of immigration has a role to play if called upon to do so. So at the end of the day, in our discussions with the Prime Minister this morning, I assured him that one of the constant balancing features of national security is we make decisions to protect the public's interest. So we are not going to let any individual or individuals jeopardize the public's interest. That is where our defense force and our Trinidad and Tobago Police Service, if called upon to act, will act on instructions from the Minister of National Security based on advice from the Minister of Health.
Okay, so the Standing Committee, as well as the Minister of Health's new powers to add to the list of the travel restriction, that is effective immediately?
Correct. It's been approved and confirmed by Cabinet.
Okay, Minister, when you were speaking about the additional beds at Cora, as well as, I believe it was... Yes, so you said it was about 2 or 3 weeks until all of this could come on stream. Now, within the past week alone, we've seen the numbers jump drastically. I'm talking about internationally, outside of China, the numbers of cases, confirmed cases as well as deaths. We saw it going from 3 confirmed deaths up all the way up to about 40 cases in the span of a week. Are you concerned at all outside of China, globally? Right? So with this rapid progression of it, do you think the 2 or 3 weeks would be too long?
No. So let's bring in some science into the question. The way your question is phrased gives the impression to the unsuspecting is that everybody has to be hospitalized. If you have, let's say, a population of 100 people with coronavirus, let's say, theoretically, 81% of those people may not even know they have it or have such mild symptoms requiring no treatment. So 81% don't require treatment or may not even know they have the disease, okay? That leaves you with 19 people. Of those 19 people, 14% may need some sort of supportive care. And only 5% may need advanced ICU care. Those are the numbers we are looking at. So when your question was phrased, if it is not explained, it gives the impression that everybody will know they have it and will need a hospital bed. That is not so. As I said, let me just repeat. 81% of people may not even know they have it, or they may have such a mild form to require no treatment. The rest is what you have to be concerned about. So we are confident that with our bed capacity, we are more than prepared to deal with it.
And just to come in here to add to what Minister said, the Cabinet asked itself those questions, and that is why we've designated the Couva facility. We've identified 230 beds at the Couva facility. It can be a very isolated facility. National security can play whatever role it needs to be as well.
Yeah.
Did you visit it?
Yeah.
They're visiting now.
Yeah.
Or they're visiting. I'm informed that the team is visiting now. They're visiting there as well with UDCOT. So whatever arrangements have to be made to accomplish what we want to achieve, which is around 230 bed facility for isolation, and as Minister Deyalsingh just pointed out, the various tiers of response that you would need, because not everybody is going to be in an ICU. I think maybe at this stage we can ask the CMO to just provide some of the, okay, one more question, but I want the CMO and the experts to provide us with the information related to this, because that is very, very essential when you start to understand who are the most vulnerable, people with struggling immune systems and this type of thing. So I'll leave the experts. We'll just take one question and then ask them to respond.
Just that, given the fact that Saudi Arabia has put a ban on pilgrims entering, did that factor into our decision not to put that country on the list? Or
no, but Saudi Arabia is doing that because what you have with persons traveling to Mecca for Hajj is you have a massive influx from all over the world. So they have taken a decision, and also because of where they're located and some of the areas in that region who are Muslim by religion. So that is a decision that they took specifically. For example, one of the questions we asked yesterday at our meeting, a close hub to Trinidad and Tobago for international air travel, is Panama. So the first question I asked is, what has Panama's position been? But of course, people are also weighing the economic factors. We, whilst being aware of economic factors, are seeking to put as our first priority the protection of the population. So Saudi Arabia really doesn't come into play for us whatsoever. They have just put a blanket, and understandably so, because that is millions of people converging on an area. And understand it is really a taxing of your resources potentially. I'll see Chief Medical Officer.
So just before you go to the Chief Medical Officer, I want to address something about the deaths of due to coronavirus. Whilst we are saying not to panic, as Minister of Health, I don't want to come across as not treating this thing seriously. But when you look at the death profile, the demographic of those who have died, it mirrors almost exactly what has happened with influenza deaths. It tends to be the elderly with coexisting medical conditions that depress the immune system. So this is a very serious matter for the elderly especially. When you look at those who have died, they tend to be 60 and above, 70s, 80s, with diabetes, high blood pressure, obesity, they are smokers, some other pre-existing conditions. So it's very serious. And I want to make a plug here again. Even though the influenza vaccine will not protect you against coronavirus, if you are not vaccinated against the flu and you get coronavirus, your immune system will not be able to respond. So let me make this clear. I am not saying that the influenza vaccine will protect you against coronavirus. What I am saying is that the influenza vaccine will boost your immune response in case you get coronavirus. You are only now battling one virus instead of trying to battle two viruses at the same time. So there's a heightened place now for the elderly who have been talking to since last year, October, to get vaccinated. If you needed a reason to get vaccinated, it is this, to help protect you from battling not one virus, but two. If you are trying to battle two viruses at the same time, your immune system can't cope. So now I'll turn over for you to ask questions.
No, I mean, as Minister started, we have to start with what we know when we're dealing with the unknown. So the coronavirus is a novel virus to the world. So we have to start with things that we know. It is the same family, as we have been saying, as SARS, as MERS, which is Mediterranean Respiratory Syndrome. So we have known those viruses. We know how they behave. I think most of the researchers pointed to the fact that they are 80% like SARS in behavior. So we have an idea of the incubation period, meaning the 14 days as thus far. There have been reported in the world, throughout the world, some outliers in terms of that, and that's what we think they are at this point. Outliers in terms of the incubation period. Some people have said that they got picked up the virus many days after 14 days. So we're treating it as outliers for now. WHO stands by the 14 days as of now. The signs and symptoms are very much like any viral illness, very much like the flu, very much like the common cold. You get fever, shortness of breath, very common symptoms, body pain. So it is almost indistinguishable from any other viral respiratory illness at this point. So those are the things that we have to lean on, the things that we know for now. The research is quickly going on in parts of the world that have been affected, and we're learning from those as well as quickly as we can. And the strategies and the measures that we have put in place are based on the research that we have gathered from the cases that already occurred. So in terms of taking the note to cabinet, we would have considered the fact that in those additional countries there was local spread, there was rapid spread, there's still no vaccine, there's still no specific treatment for it, as well as the fact that there's rapid transit between those countries and Trinidad, which poses a risk, and we're trying to do some level of containment at this point. So we go from containment, which includes preparedness, and then we go to response. So Minister would have spoken about our capacity to respond. The Caribbean Public Health Agency also has a regional plan, which is aligned to Trinidad's pandemic and influenza plan, so they're all aligned. And we have been in contact with CAFA and PAHO with regards to making sure that we make the necessary adjustments if need be based on the research coming out of the other parts of the world.
The normal flu symptoms, but they are coping with it, with the normal sort of Panadol or whatever. Should they seek to find out whether, that there is this possibility, or should they just...
At this point in Trinidad and Tobago, the greater risk to the population in terms of death is still influenza. So I would, as we have been saying all along for influenza, of course, prevention is better. So you have your vaccine, as Minister would have said. But if you have symptoms that are getting worse, you have shortness of breath, you have vomiting, abdominal pain, especially in childhood, diarrhea, that is not stopping. In addition to the other symptoms, the better bet is to seek medical attention out of abundance of caution than to stay at home and get worse. We can test for H1N1 as well, so when they do the respiratory screen, we will test through CAFA for both of them. So we test up to 14 different pathogens when we send the sample. Either we can send blood, we can send urine, or we can send a nasopharyngeal swab. So we test for all pathogens at the same time.
Shortness of breath and the vomiting, when it progresses?
I mean, those are warning signs, right? There will be individual risk, and there are high-risk groups that Minister had alluded to. Persons over 65, obesity, persons with chronic diseases, asthma as well. Children less than 5, pregnant women are at high risk, and those are immunocompromised. So those people need to be particularly careful, and of course, seek medical attention urgently, even if you are just feeling extremely unwell. I feel you go in earlier rather than later. The ones that have resulted in mortality in most parts of the world are the ones that seek attention late, and that's what we're trying to avoid.
Can you tell us a little bit about the capacity of people capable to train to screening? How many, where are they, which hospitals are they in all the hospitals?
Right, so all the frontline staff would have been trained, and because we were dealing with influenza for many, many years, the response is almost the same as the influenza response in terms of the training, in terms of the personal protective equipment that we have. So those staff would have been well trained many, many years ago. We have restarted the training in usually we start the training just about the beginning of the flu season, which is October. So we would have started retraining every year because you get new batches of people coming into the system to ensure all of them are well trained. And that has been ramped up a bit because of coronavirus. We are ensuring we have the necessary personal protective equipment to deal with any cases that may arise. The frontline staff, the ones in the emergency departments, the primary care staff, as well as the ICU and HDO staff are the primary staff that have been retrained thus far, and those are the critical staff that need to be trained in the health sector.
While I'm still on the topic of training, if I could go back to the Minister of National Security, and if things go worse and national security is really needed, what is the type of training that our officers are
So already there are officers with certain levels of training in dealing with these types of situations. But what I asked for yesterday at the meeting with Ministry of Health, as well as PAHO and CARPA, etc., is for them to design and let me get personnel trained at these courses. They are the experts. They will know what it is that these officers, men and women, should be trained on for us to provide the necessary assistance. There's one thing that we forgot to mention as well today that Cabinet also agreed to. And we have agreed that until further notice, all official overseas travel and government-assisted and funded travel to these restricted designated areas will be put on hold. Because, of course, we don't want to be sending people out to these areas. So that is a government decision.
I just want to come in here on one point. I want to reassure the country through the media that the protocols we are using were not invented for coronavirus. We always had these protocols to treat with infectious diseases. They have always been used, like for meningitis, foot and mouth disease, influenza. What we are doing is taking those same protocols and just streamlining it and making it particular to coronavirus. So I want the population to know what we are doing. We have been practicing it. It has been ongoing for years. And at the start of every flu season, we have sensitization, we have training. The only difference now is a heightened response and some training, particularly to deal with COVID-19.
Private medical medical practitioners in all of this? Is it that if you get these things, you should go first to the health center, or what?
Well, I mean, people will present to the private practitioners with signs and symptoms, and we have gotten a few cases, and the medical practitioners have called into us. So our link between the private practitioners and the Ministry of Health is twofold. We have something called sentinel surveillance physicians, sentinel physicians, so there are about 8 in each county. They are physicians that are private practitioners, but they report illnesses to us when they get them. The Trinidad and Tobago Medical Association, TTMA, we have very close contact with them. So all our information dissemination would go from us, to them, and then to the membership, which includes all the private practitioners. We also have public sector. A lot of the public sector physicians will have private practice as well. So that there's that link. So once we do training in the public sector, there's cross-fertilization in the private sector.
Minister Deyalsingh, a couple of observations actually, and I was at the Panorama finals, and in the bathrooms outside there was no soap at all, and the observation is that the schools place potentially, and a lot of children at school, some of the bathrooms and so on are not in a good state. So I'm not sure what can you do to use your good office to reach out to these agencies and just because this is, I think the virus is spread not by somebody sneezing on you and all this face mask thing, but actually touching things that somebody else has touched,
Well, it could be both. The major mode of transmission for coronavirus is via droplets. When you sneeze, when you talk, when you blow your nose. However, one of the major ways to stop the transmission of the virus is to wash your hands as frequently as possible and also avoid touching your face. Because if your hands have the virus from a hard surface or shaking somebody's hands and you touch your face, you are actually taking it to a point of entry. Could be through your eyes, through your nose, through your mouth. So both things are important. Your point about dirty bathrooms your point is noted, and I will certainly pass it on.
I mean, do you use like moral suasion, or do you need, I know we have things like yellow fever law, do you need an equivalent of that you could crack the whip and say, look, get those schools cleaned up and...
The public health
Normally under the public health ordinance, what happens is that there are inspections of the facilities, bathroom facilities, by the inspectors. Usually if you find that type of thing happening, you also find structural deficiencies in the facilities, which we can actually close a school for under the public health ordinance. So I think there's enough wit in the public health ordinance to deal with it. But of course, things like hand washing and stuff more is a matter of public education, which the public health inspectors can do as well as they go, and have been doing all along.
That brings home the point, and it's a point I made over the carnival season on a different topic, but it's pertinent here. At the end of the day, personal responsibility is your first line of defense. All right, you can't count on the CMO, on the Minister of Health, on the police, on the Minister of National Security. So ask everybody, as usual, please be personally responsible, as the Minister of Health said, and I told them yesterday they have been doing a great job campaigning with their communications. I have seen in all of the newspapers, on the television for the past few weeks, certain steps that each individual can take and should take as a matter of personal precaution. Washing your hands, if you're sneezing, sneeze into a handkerchief, a tissue, dispose of it, these types of things. So just follow those personal tidbits and it will provide you with that first level of response of protection.
You made a call for people to be responsible with the information disseminating concerning the virus, and we've seen where people have, but sometimes the information comes from people within the hospital. Now, I know somebody personally who's a phlebotomist who said she's sure there's a case here. So if that's coming from a medical expert, I mean, it will give the public, make them think there's some validity to it. How do you address something like that?
Look, we have to call on everybody to be responsible. The only way somebody could be sure of a case of coronavirus is via taking a sample, whether it's a nasopharyngeal swab through your nose or through your throat, a urine sample or a blood sample, and sending it to CARFA. No phlebotomist drawing blood can make a determination. That is plain recklessness. Well,
We just talk about being responsible.
we just talk about being responsible, and there you go. To impugn the reputation of CARFA. CARFA is an independent body set up in 2012 under a CARICOM Heads of Government Agreement. They have no political axe to grind. And I have complete faith that when CARFA says a test is negative, it is negative. And CARFA is the reference lab for the CARICOM area. So CARFA has nothing to hide. They are not politically motivated. They are not politically aligned. As a matter of fact, there was a virtual meeting yesterday that PAHO set up with individual ministers of health. And I was pleasantly surprised at the independent stance that Dr. Joyce St. John took. She's the new technical director of CARFA. She took a very independent stance. And when I see her, because she was not in Trinidad, when I see, I have to congratulate her. So I have total faith in the independence of CARFA and their capacity to lead this fight as far as testing protocols are concerned.
From the moment a person is, let's say, pull aside, for want of a better word, to be screened, yes, to when the results actually come out, how long is that process?
Yeah. So generally speaking, from the time that a test is actually, a sample is taken, forgetting the time that it takes to actually get physically to the lab. During the lab, it will take anywhere between 3 to 4 hours. The overall time we give between 24 to 48 hours, including transit time. But the physical test, once it's at the lab, is about 4 hours.
I read somewhere where they said that there's a patient that tested, it was like 6 or 7 times it came negative, and then does that happen?
Well, I saw the particular case myself on a journal. And they had, I can't say, and it wasn't clear in the journal whether they were tested while they had no symptoms. So generally speaking, the virus shows up at different points in any illness. So there are times that the best time to test this disease is from the onset of symptoms for the first 5 days using nasopharyngeal swabs, and that's what the lab will tell you. So if you test before that or you test after that, you could get false negatives. All right?
Okay. No other unrelated questions, right? I'd like to take this opportunity to just, as we wrap up, as the Minister of National Security, just to thank all of the persons who worked out of national security to make it a very safe and successful carnival. That's our Trinidad and Tobago Police Service, or Defence Force, or Intelligence Services, Fire Services, and everyone else who contributed, our traffic wardens and others, for really, including the lifeguards, for really making it a safe and successful Carnival 2020. Thank you all very much.
And that was live coverage of the weekly post-cabinet media briefing on TTT Talk City 91.1 FM and on TTT Live Online on Facebook. Remember, we'll have more on matters coming out of today's briefing in our major newscast. I'm Mahalia Joseph Wharton. Have a good day.